Good morning, sir. My name is Rosalinda Ballesteros, and I'm going to discuss the standard precaution and transmission-based precaution. First is, what is standard precautions? Are the work practices required to achieve a basic level of infection prevention and control. It aims to minimize and, where possible, eliminate the risk of transmission of infection, particularly those caused by blood-borne viruses. Next is, what is hand hygiene? Hand hygiene refers to both washing with plain or antibacterial soap and water, and to the use of alcohol gel to decontaminate hands. When hands are not visibly soiled, alcohol gel is the preferred method of hand hygiene when providing healthcare to clients. Hand hygiene should be performed before and after contact with the client. Immediately after touching blood, body fluids, non-intact skin, mucous membrane, or contaminated items, even when gloves are worn during contact. Immediately after removing gloves, when moving from contaminated body sites to clean body sites during client care, after touching objects and medical equipment in the immediate client care vicinity, before eating, after using the restroom, and after coughing and sneezing into a tissue as a part of respiratory hygiene. Next is PPE, or personal protective equipment. PPE includes items such as gloves, gowns, masks, respirators, and eyewear used to create barriers that protect skin, clothing, mucous membrane, and the respiratory tract from infectious agents. PPE is used as a last resort when work practices and engineering controls alone cannot eliminate worker exposure. The items selected for use depend on the type of interaction a public health worker will have with a client and the likely mode of disease transmission. Wear gloves when touching blood, body fluids, non-intact skin, mucous membrane, and contaminated items. Gloves must always be worn during activities involving vascular access, such as performing phlebotomies. Wear a surgical mask and goggles or face shield there is a reasonable chance that a splash or spray of blood or body fluids may occur to the eyes, mouth, or nose. Wear a gown if skin or clothing is likely to be exposed to blood or body fluids. Remove PPE immediately after use and wash hands. It is important to remove PPE in the proper order to prevent contamination of skin or clothing. If PPE or other disposable items are saturated with blood or body fluid, such as that fluid may be poured, squeezed, or dripped from the item, discard into a biohazard bag. PPE that is not saturated may be placed directly in the trash. Saturated waste generated from the home should be placed in sealable leak-proof plastic bags before placing in irregular trash can bags for disposal. Next is needle stick safety and prevention. Are implemented to prevent healthcare worker exposure to blood-borne pathogens. The Needle Stick Safety and Prevention Act mandates the use of sharp with engineered safety device when suitable devices exist. The safety devices or needles and other sharps should be activated immediately after use. Used needles should be discarded immediately after use and not recapped, bent, cut, removed from the syringe or tube holder, or otherwise manipulated. Any used needles, lancets, or other contaminated sharps should be placed in a leak-proof, puncture-resistant sharp container that is either red in color or labeled with a biohazard label. Do not overfill sharp containers. Discard after 2 to 3 full or when contents are at the full line indicated on the containers. Use sharp containers may be taken to a collection facility such as an area pharmacy, hospital, or clinic that provides this service. Next is cleaning and disinfection. Client cares areas, common waiting areas, and other areas where clients may have potentially contaminated surface or objects that are frequently touched by staff and clients, doorknobs, sink, toilets, other surface, and items in close proximity to clients should be cleaned routine with EPD registered disinfectant following the manufacturer's instructions for amount, dilution, and contact time. Housekeeping surface such as floors and walls do not need to be disinfected unless visibility solved with blood or body fluids. They may be routinely cleaned with a detergent only or a detergent disinfectant product. Most disinfectants are not effective in the presence of dirt and organic matter, therefore cleaning must occur first before disinfection. Wet a cloth with the disinfectant, wipe away dirt and organic material. Then with a clean cloth, apply the disinfectant to the item and allow to air dry from the time specified by the product manufacturer. Some pathogens such as norovirus and Clostridium difficile are not inactivated by commercial disinfectants routinely used in local public health settings. In situations where contamination with this pathogen is suspected, a bleach solution is recommended for disinfecting contaminated surfaces and items. Some patients' care items may be damaged or destroyed by certain disinfectants. Consult with the manufacturer of the items before applying disinfectants. Next is respiratory hygiene. Clients in waiting rooms or other common areas can spread infections to others in the same area or to local public health agency staff. Measures to avoid the spread of respiratory secretions should be promoted to help prevent respiratory disease. Transmission. Elements of respiratory hygiene and cough etiquette include covering the nose, mouth with a tissue when coughing or sneezing, or using the crook of the elbow to contain respiratory droplets. Using tissues to contain respiratory secretions and discarding in the nearest waste receptacle after use. Performing hand hygiene, hand washing with non-antimicrobial soap and water, alcohol-based hand rub, or antiseptic hand wash. Immediately after contact with respiratory secretions and contaminated objects materials, asking clients with signs and symptoms of respiratory illness to wear a surgical mask while waiting common areas or placing them immediately in examination rooms or areas away from others. Provide tissues and no-touch receptacles for used tissues disposal. Spacing seating in waiting areas at least 3 feet apart to minimize close contact among persons in those areas. Supplies such as tissues, waste baskets, alcohol gel, and surgical masks should be provided in waiting and other common areas in local public health agencies. Place cough etiquette signs where the general public can see them. Next is waste disposal. The Wisconsin Department of Natural Resources, or DNR, regulates the management of medical waste under Chapter NR 2526, link is external, of the Wisconsin Administrative Code. Anyone handling, storing, or disposing of medical waste is covered under this chapter. Home generators of medical waste are exempt except of rules related to the safe disposal of sharps. Sharp items should be disposed if in containers that are puncture-resistant, leak-proof, closable, and labeled with the biohazard symbol or are red in color. Sharp containers should be replaced when filled up of the indicated full line. Items generated by local public health agencies that should be discarded into sharp containers, including contaminated items that may easily cause cuts or punctures in the skin, used needles, lancets, broken glass, or rigid plastic vials, and unused needles are lancets that are being discarded. Syringe or blood collection tube holders attached to needles must also be discarded, still attached to the needles. Non-sharp disposal items saturated with blood or body fluids should be discarded into biohazard bags that are puncture resistant, leak proof, and labeled with a biohazard symbol or red in color. Such items may include used PPE and disposable rags or cloths. Local public health agency staff can transport infectious waste themselves or contract with the waste hauler to collect and transport waste. Agencies that generate less than 50 pounds of infectious waste per month do not need a license from the DNR to haul infectious waste from their facility to waste disposal site. A local public health agency that generates infectious waste is required to maintain a log of waste that is transported from the agency, regardless of the amount or how it is transported. The log must contain the following information: date of disposal, location to which waste is transported, name of the person transporting the waste, and the amount of type of waste transported. Care must be taken to contain the waste during transport. Keep waste separate from clean items in the transport vehicle and to clean the disinfect areas of the vehicle containing infectious waste before hauling clean items and materials. Next is safety injection practices. Outbreaks of hepatitis B and hepatitis C infectious in U.S. ambulatory care facilities have prompted the need to re-emphasize safety injection practices. All healthcare personnel who give injections should strictly adhere to the CDC recommendations. Safety injection practices, which include use of a new needle and syringe every time a medication, vial, or form bag is accessed. Use of a new needle and syringe with each injection of a client, using medication vials for one client only whenever possible. Safety injection practices packet. Next is transmission-based precautions. Transmission-based precautions are the second tier of basic infection control and are to be used in addition to standard precautions for patients who may be infected or colonized with certain infections agents for which additional precautions are needed to prevent infection transmission. Next is contact precaution. First, ensure appropriate patient placement in a single patient space or room if available in acute care hospitals. In long-term and other residential settings, make a room placement decisions balancing risk to other patients. In ambulatory settings, place patients requiring contact precautions in an exam room or cubicle as soon as possible. Next, use personal protective equipment or PPE appropriately, including gloves and gown. Wear a gown and gloves for all interaction that may involve contact with the patient or the patient's environment. Donning PPE upon room entry and properly discarding before exiting the patient room is done to contain pathogens. Next is limit transport and movement of patients outside of the room to medically necessary purposes. When transport or movement is necessary, cover or contain the infected or colonized areas of the patient's body, remove the dispose of contaminated PPE, and perform hand hygiene prior to transporting patients on contact precautions. Don't clean PPE to handle the patient at the transport location. Next is use disposable or dedicated patient care equipment. If common use of equipment for multiple patients is unavoidable, clean and disinfect such equipment before use on another patient. Next is prioritize cleaning and disinfection of the rooms of patients on contact precautions, ensuring rooms are frequently cleaned and disinfected. This daily or prior to use by another patient if outpatient setting, focusing on frequently touched surfaces and equipment in immediate vicinity of the patient. Next is Droplet Precaution. First, source control. Put a mask on the patient. Second, ensure appropriate patient placement in a single room if possible. In acute care hospitals, if single rooms are not available, utilize the recommendations of alternative patient placement consideration in the guideline for isolation precautions. In long-term care and other residential settings, make decisions regarding patient placement on a case-by-case basis, considering infection risk to other patients in the room and available alternatives. In ambulatory settings, place patients who require droplet precaution in an exam room or cubicle as soon as possible and instruct patients to follow respiratory hygiene etiquette recommendations. Next is use personal protective equipment or PPE appropriately. Don mask upon entry in the patient room or patient space. Next is limit transport and movement of patients outside of the room to medically necessary purposes. If transport or movement outside of the room is necessary, instruct patient to wear a mask and follow respiratory hygiene etiquette. Next is airborne precaution. First, source control, put a mask on the patient. Second, ensure appropriate patient placement in an airborne infection isolation room or AIR constructed according to the guideline for isolation precautions. In setting where airborne precautions cannot be implemented due to limited engineering resources, masking the patient and placing the patient in a private room with the door closed will reduce the likelihood of airborne transmission until the patient is either transferred to a facility with an IIR or featured home. Third, restricted susceptible healthcare personnel from entering the room of patients known as or suspected to have measles, chickenpox, disseminated zoster, or smallpox if other immune healthcare personnel are available. Next, use personal protective equipment or PPE appropriately, including fit-tested, NIOSH approved by N95 or high-level respirator for healthcare personnel. Next is limit transport and movement of patients outside of the room to medically necessary purposes. If transport of movement outside an AIIR is necessary, instruct patients to wear a surgical mask if possible and observe respiratory hygiene etiquette. Healthcare personnel transporting patients who are airborne precautions do not need to wear a mask or respirator during transport If the patient is wearing a mask and infection skin lesions are covered. Next is immunize susceptible person as soon as possible following unprotected contact with vaccine preventable infections like measles, varicella, or smallpox. Next is done. Thank you for listening.